Good morning. In this session, we'll be dealing with the development of tongue, thyroid, parathyroid, and tonsil. So, in order to give you an overview, you can see tongue is being developed from two lateral lingual swellings and tuberculum impar. And you can also see this is called hypobranchial eminence, which is divided into cranial part and caudal part. So, if you see the lingual swellings and tuberculum impar will contribute in the formation of the anterior two-thirds of the tongue, whereas the cranial part of the hypobranchial eminence will contribute in the formation of posterior one-third of tongue, and caudal part of the hypobranchial eminence will contribute in the formation of the epiglottis. So this is the overview, and let us see the same thing with relation to the pharyngeal arches. You can see this is the first arch, second arch, third arch, fourth arch, fifth arch disappears, and you can see the sixth arch, and you can see the laryngotracheal groove. Here you can see the lingual swellings, pair of lingual swellings which are developing from the medial ends of the first arch. You can see the tuberculum impar developing between the first and second arch, and you can see a small foramen cecum from which thyroglossal duct develops. The thyroglossal duct is a precursor for the development of the thyroid gland. And here you can see this is the hypobranchial eminence which is developed from the second, third, and fourth pharyngeal arches. So this will be ultimately divided into a cranial part and a caudal part. So now you can see here the two lingual swellings are fusing along with the tuberculum impar, and here you can see the cranial part which will be forming the posterior one-third of the tongue, as you can see here. Along with that, circumvallate papilla also will develop from the hypobranchial eminence. So this we will understand when we deal with the nerve supply. So that's why the circumvallate papilla and posterior one-third of the tongue will be supplied with the glossopharyngeal nerve. Here you can see the epiglottis which is being developed from the caudal part of the hypobranchial eminence. And you can see the anterior two-thirds of the tongue, anterior to the sulcus terminalis, is developed from the lingual swellings and the tuberculum impar. So what are the main sources from which the tongue develops? The endoderm covering the pharyngeal arches will form the mucous membrane covering the tongue. Then mesenchyme of the arches will contribute in the formation of the fibrillar stroma of the tongue, and the occipital myotomes will form the muscles of the tongue. So when these occipital myotomes are migrating, they also drag their nerve supply, the hypoglossal nerve. So that's why the hypoglossal nerve will run superficial to the external and internal carotid arteries. So mandibular arches show three swellings: single midline swelling called tuberculum impar, and two lateral swellings called lingual swellings. So in the fourth week, the two lingual swellings and tuberculum impar become visible. Caudal to tuberculum impar, the epithelium will proliferate and forms the thyroglossal duct. So this is the precursor for development of the thyroid gland, and its pharyngeal site is marked by a depression called foramen cecum. As I've shown in the diagram, you can see this is the foramen cecum behind the tuberculum impar. The lingual swellings grow and fuse with each other and with tuberculum impar. These combined swellings form ventral two-thirds of tongue. The developing alveolo-lingual sulcus gradually separates tongue from the floor of the mouth. Alveolo-lingual, that means between the alveolar process and the tongue, there develops a sulcus to separate the tongue from the floor of the mouth. So in relation to third and fourth arch, pharyngeal surface shows a midline swelling called hypobranchial eminence or copula of His. So in the fifth week, hypobranchial eminence becomes visible. The hypobranchial eminence is divided into ventral and dorsal parts. The ventral part expands to form the posterior one-third of tongue, and fusion of the anterior and posterior part of the tongue is represented by sulcus terminalis, as I have shown in the earlier diagram. You can see is the sulcus terminalis. The caudal part of the hypobranchial eminence forms epiglottis. Some cells migrate from posterior one-third of the tongue and cross sulcus terminalis to form circumvallate papillae. So now muscles, 3 to 4 occipital myotomes migrate ventrally to the mesenchyme of the tongue and forms all extrinsic and intrinsic muscles of tongue. The occipital myotomes pull their nerve, hypoglossal nerve, during their migration. Hence, hypoglossal nerve crosses both external and internal carotid arteries superficially. Now, in order to understand the development, let us see the mucosa of anterior two-thirds of the tongue. So, embryonic source is from the endodermal lining of the first arch, the two lingual swellings and tuberculum impar. So, that's why the general sensation is by the lingual nerve, which is a branch of the mandibular nerve, which is the nerve of the first arch, and the special sensation is the chordae tympani nerve, which is a branch of the facial nerve. This is the pretraumatic branch of the first arch. Then posterior one-third of the tongue and circumvallate papillae, endodermal lining of the third arch. That is why general and special sensations are by the glossopharyngeal nerve, including the circumvallate papillae. Posteriormost part of the tongue endodermal lining of the fourth arch, general and special sensory by the superior laryngeal branch of the vagus nerve, posteriormost part of the tongue. All extrinsic and intrinsic muscles except palatoglassus will be supplied by the hypoglossal nerve, whereas palatoglassus will be supplied by the vagus nerve. Occipital myotones dragging their nerve supply. So if you see the anterior two-thirds of tongue, it is the lingual nerve and chorda tympani. Posterior one-third is by the glossopharyngeal. Posteriormost part is by the superior laryngeal branch of the vagus nerve, and the muscles by the hypoglossal except palatoglassus, which is supplied by the vagus nerve. You can see here, this is the anterior two-thirds of tongue. The general sensation is by the lingual branch of mandibular nerve, and taste sensation is by the chorda tympani. Posterior one-third, both general and special by the glossopharyngeal nerve, and posteriormost part by the superior laryngeal branch of the vagus nerve. And here you can see this is the hypoglossal nerve, which will be supplying the muscles of the tongue except palatoglassus, which will be supplied by the vagus. Now developmental anomalies. So like aglossia, it is complete agencies of tongue. Hemiglossia, half of the tongue is not developed due to failure of one lingual swelling. Then bifid tongue. So anterior two-thirds due to non-fusion of the two lingual swellings. So it is observed in the anterior two-thirds. Both the lingual swellings have not fused, resulting in a bifid tongue. So tongue tie or ankylosglassia occurs due to incomplete formation of the alveolar lingual sulcus. The tongue is connected with the floor of the mouth by short frenulum. And microglossia, it's a small tongue, or macroglossia, it's a large tongue. Ankylosglassia superior, where tongue is attached to the palate. Lingual thyroid, so when thyroid gland appears within the substance of the tongue, we call it as lingual thyroid. It is due to failure of migration of the thyroid gland. Now, before going to the development of the thyroid gland, parathyroid gland, and palatine tonsil, let us review the development of pharyngeal pouches. You can see this is the first pouch. This will be the tubotympanic recess. Here you can see from the second pouch, you can see this palatine tonsil. So here you can see this is the part contributing the formation of the tubotympanic recess from the second pouch. So this is the part from the second pouch which is contributing in the formation of the palatine tonsil. Here you can see the third pouch is contributing in the formation of the parathyroid 3 or inferior parathyroid and thymus. And here you can see the fourth pouch, which is taking part in the formation of the parathyroid 4 or superior parathyroid and the lateral thyroid element. So the fourth pouch and fifth pouch together, they form caudal pharyngeal complex, which will have the thymic element, lateral thyroid element, and also the ultimobronchial body, which contributes in the formation of the parafollicular cells of the thyroid gland. But nowadays, recent studies suggest that the parafollicular cells has developed due to migration of the neural crest cells. So you can see here from the first pouch, auditory tube, tympanic cavity, inner surface of the tympanic membrane. From the second pouch, palatine tonsil, tonsillar fossa and intratonsillar cleft. From the third pouch, inferior parathyroid gland and thymus. From the fourth pouch, superior parathyroid gland. The caudal pharyngeal complex, which is formed by the fourth and fifth pouch. They have a thymic element, which forms part of thymus, lateral thyroid element, which forms part of thyroid gland, and ultimobronchial body, which forms parafollicular cells. And otherwise, they say it is the neural crest cells migration. So thyroid gland develops from following sources: the follicles from the follicles from the thyroglossal duct, parafollicular cells from the ultimobronchial body, which is the part of the caudal pharyngeal complex, as I said earlier. The thymic element, lateral thyroid element, and ultimobronchial body. These are the three components of the caudal pharyngeal complex, which is formed by the fourth and fifth pouches. The fifth pouch disappears. Before disappearing, it contributes in the formation of the caudal pharyngeal complex along with the fourth pouch. So that's why the follicles of thyroid from the thyroglossal duct and parafollicular cells from the ultimobronchial body. So by the end of the third month, follicular cells start producing thyroid hormones. The thyroid gland is the first gland that develops after fertilization. So behind tuberculum pulpar, as I've shown in the development of tongue, there will be proliferating epithelium which forms thyroglossal duct, and the point is called as foramen cecum. The thyroglossal duct grows caudally towards the pericardial verge. Tip of the thyroglossal duct bifurcates to give rise to two lobes of the thyroid gland by 7th week. The ultimobronchial body, a part of the caudal pharyngeal complex, meets thyroid gland and contributes in formation of the parafollicular cells. So this is the foramen cecum. You can see this is the line of migration of the thyroglossal duct, and this is the normal position of the thyroid gland. So along this line, anywhere the thyroid gland descent can get arrested and result in abnormal position of the thyroid gland. You can see here endodermal thickening at the foramen cecum and lateral outpouches as the thyroglossal duct. You can see the thyroglossal duct. You can see the or splitting of the thyroglossal duct into two buds, and you can see the lateral thyroid element from the caudal pharyngeal complex is fusing with this thyroglossal duct component. So few say that this fusion will arrest the further descent of the thyroid gland, and few say that this lateral thyroid element will contribute in the formation of lateral lobe. But from the studies, it has been proven that completely the lateral lobe is developed from the thyroglossal ducts itself. They actually help in proliferation of the lateral lobes. So you can see the abnormal positions of the thyroid gland. You can see the lingual thyroid just below the submucosa. You can see the interlingual thyroid within the substance of the tongue. And here it is just below the submucosa or below the mucosa. It is more superficial. And here it is more deep. And here with respect to hyoid bone, you can see the suprahyoid and infrahyoid positions of the thyroid gland. You can see the normal position of the thyroid gland. So pyramidal lobe. So it may arise from isthmus or any one lobes. It is variable in length. It is derived from the thyroglossal duct. Sometimes isthmus or one lobe of the thyroid gland may be absent or small. And ectopic thyroid tissue. So it is presence of thyroid tissue in locations other than the usual thyroid gland migration route. So namely in larynx, trachea, esophagus, pericardium and ovaries. And thyroglossal duct defects. So usually thyroglossal duct will regress. Remnants of thyroglossal duct may form thyroglossal cyst or fistula anywhere along the course of the thyroglossal duct. Thyroglossal cyst is an irregular mass or lump in the midline of the neck. Occasionally, thyroglossal cyst will rupture externally, resulting in draining sinus called thyroglossal fistula. Rarely, this can result in development of cancer. Now coming to the development of parathyroids, there are 4 parathyroids, a pair of superior and a pair of inferior. The 2 superior parathyroid glands are derived from 4th pharyngeal pouch, and 2 inferior parathyroids are derived from 3rd pharyngeal pouch. So dorsal part of the 3rd pouch grows and loses contact with the pharynx and then descends caudally along with thymus. Finally, it loses contact with thymus and forms inferior parathyroid gland. This is the parathyroid 3. And the dorsal part of the 4th pouch grows and loses contact with the pharynx. Later, it descends caudally to form superior parathyroid. So from the 3rd pouch develops the parathyroid 3 or inferior parathyroid gland, and from the 4th pouch develops the parathyroid 4 or the superior parathyroid gland. This is parathyroid 4. Parathyroid 4 or the superior parathyroid gland, which develops from the 4th pouch. Parathyroid 3 develops from the 3rd pouch. So now if you observe the inferior parathyroid or the parathyroid 3 developing from the 3rd pouch, and with the migration of this thymus, this will be pulled down and comes inferior in position. And then if you see, this is the parathyroid 4 or superior parathyroid developing from the 4th pouch, and the lateral thyroid element will just join with the thyroglossal duct and will stop the further descent of this parathyroid 4. So parathyroid 4 will become the superior parathyroid and parathyroid 3 will become the inferior parathyroid. Then coming to the development of palatine tonsil. So palatine tonsil develops from 2 sources: the endoderm of the 2nd pharyngeal pouch and the mesoderm from the lymphocytes. You can see here. So this is from the 2nd pharyngeal pouch. You can see the development of the palatine tonsil, and the mesoderm will contribute in the formation of the lymphocytes and the capsule. The endodermal pouch, that is the 2nd endodermal pouch, will contribute in the formation of the palatine tonsil. Mainly, which will be seen in the adults as the intertonsillar crypts. One of the largest will be the intertonsillar cleft, and the lymphocytes will be derived from the mesoderm, and the capsule also will be derived from the mesoderm. So during the 3rd month of development, ventral part of the 2nd pouch proliferates outwards into surrounding mesoderm as several solid cords called tonsillar buds. On degeneration of the central cells, tonsillar buds cannulate to form hollow tonsillar crypts. So these are the crypts which we observe on the gross as well as in the histologic sections. So during the 3rd to 5th month, lymphocytes aggregates on the mesoderm that surrounds crypts and forms lymphatic follicles, and the mesodermal cells condense to form a capsule of the tonsil. The lymphocyte proliferates and forms pharyngeal tonsillar bulging. The remnant of the pouch is represented by intratonsillar cleft. You can see here from the second pouch, you can see the palatine tonsil growing. This is a tonsillar bud. You can see the tonsillar clefts, and this will be surrounded by the mesoderm, which will form the lymphocytes, which will proliferate to form the lymphoid follicles, and further they grows to form the tonsil bulge. You can see here from the third pouch, the inferior parathyroid is being dragged down along with the thymus, making it inferior in position. And you can see from the fourth pouch, the lateral thyroid element will fuse with the thyroglossal duct and retain the fourth parathyroid position as a superior parathyroid. This is how the third parathyroid becomes the inferior and the fourth parathyroid becomes the superior. This third and fourth parathyroid will represent the fourth and third parathyroid will just represent the number of the pouch from which they are developing. Third parathyroid is developing from the third pouch, and fourth parathyroid is developed from the fourth endodermal pouch. But the fourth parathyroid is superior parathyroid and third parathyroid is inferior parathyroid. So overview, you can see the endoderm from the second pharyngeal pouch forms a tonsillar bud, and which will be canalized to form the tonsillar crypts. One of the largest one will be the intertonsillar crypt. Mesoderm will form lymphocytes, which result in lymphatic follicles, and it also develops the capsule. Ultimately, all the three components are contributing in the formation of the palatine tonsil. So in this session, we have seen development of the tongue, in which mainly there were two lingual swellings and tuberculum impar and hypobronchial eminence. Then we have seen the development of the thyroid gland, which was mainly by the thyroglossal duct, and then a small contribution from ultimobronchial body and lateral thyroid element. And then we have seen the development of parathyroids, mainly developed from the third and fourth pouch, and we have seen the development of palatine tonsil mainly from the second pouch, second pharyngeal pouch. Thank you.